Exchanges are new, organized marketplaces that individuals and small businesses will now be able to use to buy health coverage. They were created by the Affordable Care Act in 2010 and are really one of the main ways to help increase coverage for the many Americans that currently don't have it. Health reform does many things, one of which is to help more people get insurance and help that insurance become more meaningful and more valuable. And exchanges are really the centerpiece to that goal. The Affordable Care Act allowed states three options. They could create an exchange on their own, they could partner with the federal government to create one, or they could let the federal government create an exchange in the state. For states, the options, the benefits of really creating a state-run exchange is that most states right now really regulate insurance. They have a lot of history of doing so. They control other state healthcare programs, and really it allows the governor, the legislature, other stakeholders to maintain control over how the exchange is built. It lets you really design it and tailor it to your residents, to your market, and your needs. But at the same time, no matter what a state decides, the Affordable Care Act does ensure that every resident will have access to an exchange and the meaningful coverage it provides. The Affordable Care Act lets states have an enormous flexibility in how they design their exchanges. And so some have taken an approach that's very aggressive to try to use a lot of the tools to help make the insurance coverage more understandable, more transparent, and really add as much value as possible to the consumers that are going to be buying it. Other states have taken a more passive approach, perhaps letting the market sort of play itself out, or taking a more transitional approach before they enact some of the other tools in the Affordable Care Act. Either way, it really sets a new bar for what coverage has to be sold and a new way for individuals, especially those who have a hard time paying for insurance, to get access to affordable coverage. Well, one of the most important things in creating an exchange is really making sure that stakeholders are engaged and are included in the process. And so some states have done so very well, and others have done so perhaps less than would be desired by those stakeholders. A few have maybe done the bare minimum, had hearings or had some phone calls, had town hall meetings, while others have really created a very formal process of working groups where individuals from insurance companies, brokers, providers, advocacy groups, and patients will come together around a table, work with government staff to come up with the policies on how the exchange will build. And we're seeing that really work well in some states. And others have sort of used in-between approaches of inviting, learning from other states or fielding comments through public documents. But clearly the most important thing is ensuring that the ultimate end user, the consumer, the small business owner, has a place at that table and is able to help make sure it's going to be meaningful for them. I think the biggest challenges that have pretty much been universally cited among every state that's moving forward with an exchange is time. The timelines, originally when the bill passed, we thought we had a lot of time between 2010 and 2014, and now we're just seeing that some of the lifts are just quite large, especially on the IT side. So building this new organized marketplace is going to rely heavily on 21st century web-based technology, which is wonderful for the consumer to make it much more easy to buy and compare plans, but it's going to take a lot to build. And so we're seeing states really scramble to get done on time and to meet the deadlines to make sure we're live and ready in October of 2013. I think some of the leading states would mostly agree that the best thing was starting early. And so for those states that really moved forward after the Affordable Care Act was passed and formed committees within their government, included other people, passed laws, created exchange agencies and boards, they really are the ones out in front. I think the other thing that we've really seen work well is really including the stakeholders at the table, ensuring your insurance companies, your brokers, your consumer advocates, your providers are all there so that when policies are set, there's already buy-in. There's no additional lobbying that needs to happen to make sure people understand what's happening and get them on board. Because the timeline is so tight that you really need to make sure that the decisions are inclusive of folks' values, of their needs and their interests, and are going to serve the people the best once it actually goes live in October. I think as states are building these exchanges and as the federal government's building the one they'll be operating in many states, we know that right now they're really focused heavily on what they need to do to go live in October so that people can get new coverage in January. And that's an important goal that has to be done. But one thing we see is that the Affordable Care Act creates an enormous new opportunity for more people to get insurance coverage. And what we want to do, and we hope can happen, is have that insurance card translate to better access to care, and have that access to care translate to better health outcomes. So clearly the next step, both at the federal level and at the state level, will be really moving beyond just coverage and making that coverage mean improved health. So changing the way we pay medical providers in sort of what they're calling payment reform or delivery system reform. Helping more people come together and figure out preventive medicine strategies and getting more people active in their care. That's really what we're going to have to do once we get people covered and hopefully can do so in the next couple of years.